So I am doing this mama's postpartum, the bubble he assessment. I am first going to look at her chart to see if there was any changes. I'm going to wash my hands, put on some gloves, gonna introduce myself, drape her. Privacy, if this spouse wants to be in here, she can be, I'll ask. I'm also gonna put the cord, if it's a private room, the door or a curtain, if it's shared. So I'm gonna ask about her breast, if she is breastfeeding or if she is bottle feeding. That will depend on my assessment on the breast today. But for this mama, she is breastfeeding. So I am going to look at her breast. I'm gonna ask her if it's painful when the baby latches on. No, okay. So I'm gonna look at her breasts. I'm gonna be looking at the symmetry of them. I'm gonna be looking at the size of them, if one's bigger than the other. Symmetry, size. I'm gonna also be looking at the nipple. I want to make sure that it's not red or cracks in it, because that can be very painful for the mom, or if the nipple is inverted or not, because that can be also a reason that it hurts to latch on. Abnormal findings would be meltitis. It is an infection from the baby that the baby gives the mommy through the breast, and you can get chill, fever, flu-like symptoms. You can get heaviness in the breast, edema in the breast, redness, or like you feel heat coming from the breast. If that is so, you need to go to the emergency room. Now I'm going to be looking at the uterus. For the uterus, we are all looking for the fundus. The fundus is very important because it will determine if everything is going in the right direction. So my fundus should be hard. My uterus should be hard. It should not be soft. It should be firm, because firm and hard means that your uterus is contracting, and that is a good sign, because it's not a sign for hemorrhaging. But if you have a boggy uterus, so your uterus is it's not hard, that's a big sign. Now I need to ask my patient before my assessment that if she has to go to the bathroom, because if I don't ask that before my assessment, it can put pressure on the fundus in the uterus, sliding it maybe over to the right or over to the left. We want her to have an empty bladder because we want the fundus to be right in the middle. We want it to be in the umbilicus. We want it to go down 1 centimeter every day, and that would be going down positive. Now, if it was going up towards the chin, that would be negative, and we don't want that to happen. If my uterus and my fundus is not hard, big signs are hemorrhaging, so lots of blood, different signs and vitals, large golf balls, and we don't want that to happen. Now, if it does, we can massage the uterus to stimulate it to contract. Next, we're going on to bowels. So I'm going to ask my mom if she is having, and how are her bowel movements in the last 24 hours. Now, if some moms have any tears or just scared to go to the bathroom, if they do have any tears, that's not good. We want mom to go to the bathroom, because if she doesn't go to the bathroom, it can cause a bowel obstruction. So we want to listen to her stomach as well to make sure we hear bowel sounds. We want to know the type of diet mom is on, because if she did have a 3 to 4 tears, she could be on mineral oil. We want to ask how much fiber she's having, or if she needs any stool softener, because her bowel movements are hard. Now we're going on to the bladder. So I'm going to be looking at the bladder. I want to see if it's distended or not, because when mothers give birth, there's not much pressure on on our bowels, bladder, so it kind of expands and mommy doesn't know. And we need to get her up to the bathroom at least 2 to 3 times before she's discharged, and want to measure them. Now, if she is going to the bathroom and she has a tear or anything, I would suggest using a peri bottle just to help with the pain while peeing or having a bowel movement. Next, after that, I'm going to be talking about the Luchi. The Luchi is almost like a period after having birth. It's like the leftover blood and the placenta coming out. And we want to know the color. So Lucha Ruba is bright red. It happens 2 to 3 times. 2 to 3 days after giving birth, but if it goes beyond that, that is a bad sign. Serosa is a pinkish brownish. It is not as heavy as the first blow. And you might see little blood clots, but if you see baseball clots, that's a big sign that that should not be happening. So please go to the emergency room. If your Ruba is also past 3 days, go to the emergency room because those are big signs of hemorrhaging. And then the last one happens 10 to 21 days after giving birth. It's the Elba, and it's a yellowish to cream discharge coming out. I want to know the status, how heavy it is, or the little bit of the amount is coming out. I want to know if you're having any blood clots, the size of them. I also want to know if you're having any fevers or chills, if it smells, foul smell, and abdominal pain, or any blood clots. Next, I'm going to go to the episiotomy, or the prenatal tear. I'm also going to be looking at her rectal area too and assessing that. So I'm going to get my patient to go over to the side, the left. I'm going to do my rectal first. So an episiotomy is when a doctor makes a tear. So if they have a tear, I want to make sure I'm looking at the proximal of it. I want to look at the edges of it. I want to see if it's actually healing. So the edges, if it's curling or if it's going in together. I want to make sure if there's any redness, edema, inflammation happening, because those are signs of infection, and we don't want that. It would be the same as in any other wound. Now for the rectal area, if they're having any redness, if they have a 3rd or 4th degree tear up there, I need to be looking all the way up there. Now, this is maybe why if the mommy doesn't go to the bathroom, it is because of the tear and she is afraid. So that peri bottle would be a great time to use it. We'll go into the bathroom. We also want that to be soaked. We don't want it to be dry because it could hurt when it is healing. So moisture is key. But I want to make sure for bowels, hemorrhoids, and if there's bleeding, any redness due to the pressure of pushing. Now, when doing this, I would also look at their amount of, when I'm taking off their pad and everything, of their Loki, the amount, the heaviness. I can see that. I can see the color as well. Now, I can also, because they're already in here, I could probably do the peri-care, give them new things, but I'm going to do that at the end of the assessment. So we're now on E for Hellmann's, and this is just to see if they have any venous dissension or blood clots in their legs. So I'm going to ask mommy if she, you can't even see, if she has any pain while walking or in her calves. I'm also going to be looking at her legs just to see if it's hard or red or color difference, color change as well, if it's purple. I'm also going to ask mom to point her toe all the way up to the ceiling and straight leg all the way up in a dorsine flexion to see if she has any pain, and that could indicate that there is thrombosis in the leg. Now, my next one would be, and my last one is emotions. So I would talk about mommy and how she is feeling due to this is a big change. Her body is changing. She has a new baby. She might feel alone. She might have baby blues. If she has baby blues, I need to let her know that she is not alone, that she should surround herself with close family and friends to help her out through the house or the kitchen, not the baby, but her life, like laundry, just little stuff. And now, if the baby's blues last longer to 2 to 3 weeks, you should probably see the doctor to make sure that you don't have postpartum depression, because that is a serious thing and mothers can go in psychosis and it's just not good. After my assessment, I am going to, oh, I don't know if I said this or not, but for her bowels, I want to listen for 1 minute. I want to listen to her bowels, make sure that she doesn't have a bowel obstruction. I think I already said that. Just wanted to be sure. So I want to get mommy all cleaned up beforehand because we want to keep the peri area clean. I want to clean her up. I want to get her a new pad. Get her a new pad, clean her all up from head to toe. I should probably get her a new gown, Johnny shirt, a new pad if she needs new bedding. I want to get her comfortable in bed, and I want to put the call bell within reach. And that is it. I don't know if I said